There are a few things more worrying for a parent or caregiver than seeing your child in pain. And a swollen joint, that can be really scary. What does it mean? Where do you even begin? Well, in this explainer, we're going to break down how doctors figure it out, what the most likely causes are, and the critical red flags you absolutely need to know. So let's just dive right in. Picture this. Your child starts limping, or you notice one of their knees or ankles is all puffy and swollen. That single symptom is the start of a diagnostic puzzle. And the very first step is to figure out what kind of problem we're actually looking at. Here's how we're going to tackle this. First, we'll look at the initial assessment. Then, we'll get into the urgent stuff, the red flags, like infections. After that, we'll talk about what it means when swelling sticks around, which brings us to JIA. We'll touch on a few other possible causes, and then we'll wrap it all up with the key things you need to remember. So, where does a doctor even start? Well, it's not with a wild guess, that's for sure. The first step is always a systematic assessment to methodically piece together what's really going on with your child. Doctors have this really clever two-step approach. They start with something called PGALS. Think of it as a quick head-to-toe screen of the child's walk, their arms, legs, and spine. If anything seems a little off during that screen, they zoom in with step 2, PREMs. This is a much more focused exam of the specific joint, checking for things like warmth, tenderness, or any fluid buildup, which has the technical name effusion. Now, the absolute #1 priority, right out of the gate, is to rule out the most serious possibilities. And we're talking about acute infections that need immediate medical attention. This is about separating the uh-oh from the oh no. And the big one here, the one everyone is looking for first, is septic arthritis. This isn't just some minor bug. It's a serious infection inside the joint space itself. And let me be clear, this is a true medical emergency, because if it's not treated fast, it can cause permanent damage to the bone and joint. So this is crucial, knowing the warning signs. If a child is obviously sick, they have a high fever, and there's a single joint, usually the hip, knee, or ankle, that is red, hot, swollen, and incredibly painful to move, these are major red flags. For infants, it might just look like they're holding their leg or arm completely still and just screaming if you try to move it. Any of these signs mean you go to the emergency room. Period. And this brings us to a really important distinction. Septic arthritis is that emergency we just talked about, a severe illness, high fever, risk of permanent damage. But the most common cause of a swollen joint is actually something called reactive arthritis. This is a temporary inflammation that might pop up after a simple infection like a stomach bug. The key difference? The child isn't severely ill, and the expectation is that they'll make a full recovery. Okay, but what if it's not an acute infection? What if the swelling just hangs around for weeks? Well, that's when doctors start thinking about chronic inflammation. And the main condition in this category is juvenile idiopathic arthritis, or JIA. The most important part of that definition is persistent joint swelling lasting 6 weeks or more. So if that swelling just won't go away and the child is under 16, JIA becomes a really strong possibility. And this isn't some super rare thing. JIA affects about 1 in every 1,000 kids. To put that in perspective, that means thousands and thousands of families are navigating this very issue right now. Now, JIA isn't just one single disease. It actually has several different subtypes, and they're mostly classified by how many joints are involved in those first 6 months. Oligoarthritis is the most common, and that affects 4 or fewer joints. Polyarthritis, as the name suggests, involves more than 4. And then you have systemic arthritis, which is a whole different ballgame, often coming with high fevers and a very specific kind of rash. The day-to-day reality of JIA often means a lot of stiffness, especially first thing in the morning or after sitting still for a while. Sometimes people call this gelling. And here's something really important. Very young children might not be able to say, "my knee hurts." Instead, you might see them start limping, or they might get more irritable, or suddenly refuse to walk. Those behavioral changes can be the very first clue. So we've talked about infections in JIA, which are the heavy hitters. But they're not the only players on the field. The list of things that can cause joint swelling is incredibly broad, which really hammers home why a professional diagnosis is so essential. Yeah, this is where it gets really complex, because sometimes the swelling is just one part of a much bigger picture. It could be something called HSP, for instance, where the joint pain shows up alongside a very specific purplish skin rash. Or for a child who has sickle cell disease, it could be dactylitis. That's a really painful swelling of the fingers and toes caused by the disease.
Sometimes it's not even true joint swelling at all. A condition like rickets can cause the ends of the bones to widen, making the wrists and ankles look swollen.
In a bleeding disorder like hemophilia, the swelling is actually caused by blood pooling inside the joint space itself. And while it's rare, joint pain and swelling can sometimes even be a sign of something as serious as leukemia. The point of all this is to show that the possibilities are vast, which is exactly why you never ever try to guess. Okay, we have covered a lot of ground, so let's boil all of this down into the most important must-remember points. This quote right here really says it all. For almost all of these conditions, but especially for serious infections and chronic diseases like JIA, getting a diagnosis and starting treatment early makes a massive, massive difference in preventing long-term damage. So, here are your key takeaways. Number 1, don't guess. A proper medical assessment is the only way to really know what's going on. 2, that combination of a fever with a single hot, red, swollen joint is an emergency siren. Go straight to the ER. 3, if that swelling sticks around for more than 6 weeks, it's time to start thinking about chronic conditions like JIA. And finally, the sheer number of things that could be the cause shows exactly why you need a professional medical diagnosis. I want to leave you with this one last question just to really lock in the most important message from all of this. Of all the symptoms and signs we've discussed, what's the one combination you should absolutely never ignore? It's that fever paired with a single, hot, painful joint. Recognizing that could make all the difference in the world.